Hello, my name is Corey and I'm a UCF nursing student. Today I have Gabby with me and I'll be doing the head, eyes, ears, nose, and throat assessment. First I'm going to be inspecting the hair, face, expression, symmetry, skin color, then skin turgor. Also noting for any abnormal lesions on the face. Eyes are opening spontaneously. Her ears structures are intact and symmetric. I'll then inspect the external eye structures, so making sure for alignment, eyebrows, and presence of ptosis or lid lag. And then internal structures, so looking for conjunctiva, looking at the sclera, the cornea, and iris and pupils. Next I'll inspect the external structure of the nose, so looking for symmetry and any lesions on the nose. Next I'll inspect the oral mucosa, so after you open your mouth, use my pen light. I'll be looking at the oral mucosa, teeth, the tongue, the uvula, and the tonsils if they're present. Next thing I would do is palpate the skull and the sinuses. So I would maybe inspect the skull and then the sinuses, noting any tenderness. Next I'll palpate the neck for any masses, also inspecting the lymph nodes. Please tell me if you feel any tenderness, please.
Nope.
Nope. Checking the pupils for perla. This is cranial nerves 3, 4, and 6, so pupils are equal and round, reactive to light, and then I'll do accommodation. Then I'll check the ocular movement, so I'll do my 6 cardinal gazes with my pen light here. Can you please stare at the end of my pen? And I'll do my 6 cardinal gazes, checking for any nystagmus and oscillation. Next I'll do cranial nerve 8, perform the whisper test, so I would include 1 tragus and 2 feet away whisper, "Go Knights."
Go Knights.
And so cranial nerve 8 is intact. Next thing I'll do is assess cranial nerve 5, so I'll have the patient smile, then frown, lift up your eyebrows please, close your eyes tightly, and puff out your cheeks. Alright. This is cranial nerve 7, cranial nerve 7, so this is the facial nerve. Next thing I'm going to be testing for patency of each nostril for cranial nerve 1, olfactory nerve. Can you please occlude 1 nostril and breathe in through your nose? And I'll verbalize that I'll do that to the other side as well. And then do the odor test. Next I'm going to be checking for cranial nerves 9 and 10. So can you please stick out your tongue and say "ah"? With my pen light, I would look to see if the uvula and soft palate move, and then also I would test the gag reflexes here. Next thing I'll be doing is checking for cranial nerve 12, and I'll have the patient stick out their tongue, checking for midline symmetry. Next thing I'll do is check cranial nerve 5, trigeminal, and I'll be testing for sensation, so I'll use a wisp of cotton, have the patient close their eyes, and touch their forehead, cheek, and chin, just checking for sensation here. Also, can you please clench your jaw, and then I'll pull against pressure to check for cranial nerve 5.
Hi, I'm Gabrielle, and I'm going to be performing a musculoskeletal exam on Katie. I'm going to inspect for symmetry, hair distribution, masses, skin, and edema. I'm going to test her capillary refill, cap refill within 1 second, and skin turgor, which skin returns immediately. Now I'm going to test cranial nerve 11. Can you shrug your shoulders? Good. Okay. And turn your head against my resistance. Good job. Now I need to test her strength in her hands. Thank you. Can you lay flat for me? Push against my hands. Okay, good. Now I'm going to palpate pulses, brachial pulse, radial pulse, popliteal pulse, posterior tibial pulse, and dorsalis pedis pulse.
Hi, my name is Katie, and I'm going to be doing a respiratory assessment on Gabby today. First, I'm going to inspect the configuration of the thoracic cage, noting the skin symmetry, shape, and the labor of her breathing. Next, I'm going to palpate for masses and tenderness, and if I can have you turn around, I'm going to test the chest expansion. I can have you take a deep breath in and down. And she has symmetrical chest expansion. Next, I'm going to percuss the posterior lung fields. It's going to sound more resonant over the lung areas and more dull over the bony areas. And next I'm going to auscultate the lung fields. And then I would repeat this process on the anterior aspect of her chest as well. Hi, my name is Katie Rosado and this is Corey Duggar. Today we're going to be doing the cardiovascular assessment. First, I'm going to inspect the precordium for any pulsation or heaves. Then I'm going to palpate the carotid pulse, and I'm only going to do one at a time because I don't want to occlude the blood vessels and have him pass out. Next, I'm going to auscultate the carotid arteries bilaterally for bruits. Then I'm going to auscultate the rhythm at the apex. I'm going to do this for 1 minute. Next, I'm going to auscultate the 5 cardiac areas with the diaphragm: the aortic, the pulmonic, Erb's point, tricuspid, and mitral. I'm going to repeat this in each area with the bell to auscultate for murmurs. And I'm also going to do this with the patient in 3 different positions: sitting, lying supine, and left side lying.
Hi, I'm Gabrielle and I'm going to be performing a gastrointestinal exam on Katie. First, I'm going to inspect the abdominal area for contour, symmetry, inspect the skin, look for pulsations, scars, wounds, lesions, tubes, drains, and ostomies. And I notice that the contour is flat. She's in the supine position and I just need her to lift her knees. Thank you. Now I'm going to auscultate the bowel sounds in all 4 quadrants, starting in the right lower quadrant. And I auscultated normal active bowel sounds in all 4 quadrants. Now I'm going to auscultate for an aortic bruit using my bell. And I'm just going to auscultate slightly left of the midline. And I hear no bruit. Now I'm going to go ahead and percuss all 4 quadrants, starting in the right lower quadrant, and I'm looking for a sound of general tympany. I'm also using a star pattern. And I heard general tympany, so that's good. Now I'm going to lightly palpate her abdomen in all 4 quadrants. And I would deep palpation next using 2 hands. And I would go deeper. Now can I have you sit up with your back towards me? Now I'm going to test for costovertebral angle tenderness. Did you have any tenderness?
No.
Okay, thank you.